COVID-19, honorable ministers, members of the PTF on COVID-19, gentlemen of the press, a very good evening to you. Today is Monday, 14th September 2020, and I welcome you to the national briefing. Today, we will continue with the same format. We will receive the remarks of the chairman. We'll also take the technical updates. Then we will take updates from some ministers as they come in before we take your questions, and the answers will come thereafter. The day is fast spent, so we'll try to be precise about what we're doing. So when we're rolling in the questions as well, please make them compact and direct. So at this point, let me invite the chairman of the PTF to the podium for the remarks.
Members of the Presidential Task Force, distinguished ladies and gentlemen, gentlemen of the press, let me once more apologize for starting this briefing late. We had to deal with quite a lot of issues, but however, I continue to welcome you all to the national briefing by the Presidential Task Force on COVID-19 for Monday, 14th of September 2020. Friday, 11th September marked 6 months since the World Health Organization used the term pandemic to characterize the multiple outbreaks of COVID-19 reported around the world on 11th March 2020. We all recall that the organization had already declared the outbreak a public health emergency of international concern on the 30th January, which is the highest level of alarm under international health law. Over the past 8 months since the world first learned about this virus, scientists, health workers, leaders, and communities have learned a lot about how to manage it. There are tests to identify it. We have an understanding of how it affects people of different ages. A range of symptoms have been identified, and we know how to care for patients with currently available medicines and equipment. What the world still awaits is the arrival of an effective vaccine. The Presidential Task Force updated you last week about the progress made with the candidate vaccines and the phases of the trials. We also assured you that Nigeria will not be left out when eventually access is needed for a safe and effective vaccine certified by global public health authorities. Given this timeline, however, we do not expect vaccines to be available for countries probably till the second half of 2021. What this means is that we need to do more than ever before, adhere to the prescribed non-pharmaceutical interventions, and diligently avoid contracting the virus. A careful study of the numbers coming out of Africa will reveal that there is a flattening of the curve in the African region. There has been a weekly decline in the number of new COVID cases reported since 20th July. Fatalities are also on the downward trend. More than 1 million people have recovered. While this is a welcome development, as we have seen from other regions of the world, that cases can decline only to start rising again. The World Health Organization has informed that it is working in collaboration with the African CDC to launch a network of laboratories dedicated to genetic sequencing so as to better understand the evolution of the pandemic and how SARS-CoV-2, the virus which causes COVID-19, is spreading. Over time, the Presidential Task Force has been sounding the alarm bell of increasing evidence that Nigerians, and indeed Africans living with non-communicable diseases, such as hypertension and diabetes, are more likely to suffer severe cases of COVID-19 and eventually even die. The COVID-19 pandemic has reaffirmed the importance of everyone having access to quality health care that they can afford. Reports have, however, shown that diagnosis and treatment for chronic conditions are among the most frequently disrupted health services globally. A rapid survey by the World Health Organization revealed that 41 countries in sub-Saharan Africa have reported disruptions to such services. It is of great concern to find that just when people with hypertension and other chronic conditions need support the most, many are being left out in the cold. The Presidential Task Force therefore urges the various medical facilities not to neglect patients with other conditions on account of COVID-19. Nigeria continues to progressively witness declining confirmed cases of COVID-19, with a record low number of 79 cases on Sunday, September 13, 2020. While this suggests that we are winning this war, the reality is that we need to improve on our commitment to eliminate the virus completely by abiding with the protocols so that we can return to a semblance of what was our normal life. In a very modest way, therefore, we could say that our national response under the guidance of Mr. President is achieving impressive results, and this has been commended by our development partners. The Presidential Task Force wishes to use this opportunity to thank our development partners, as their support has contributed in no small measures to the successes so far recorded, and we count on their continued support as we progress in tackling this pandemic. One critical element we must not lose sight of is the fact that our cautious approach has tremendously helped in our containment efforts. Therefore, we should avoid complacency at all costs. Our focus should go beyond flattening the curve and ridding our land of this virus, just as we did with the polio virus. Similarly, the contribution of our health workers has no doubt contributed to our gains. In this regard, the Presidential Task Force wishes to appreciate the National Association of Resident Doctors, NAD, for calling off their strike action. The PTF, however, views the recent declaration of industrial action by the joint health sector unions, JHOSU, as rather unfortunate and capable of reducing our gains and endangering more loss of lives. We therefore call on JHOSU to stand up to be counted at this critical moment, because a continuation of the strike could jeopardize the small gains made in the fight against the virus and the efforts to transform our health systems. The Honorable Minister of Labor and Employment has assured that every effort is being made to resolve all issues and have JHSU call its members back to work. The Presidential Task Force, therefore, appreciates Mr. President for keeping our land borders closed, because those are potential seeding points for importation of the virus into the country. More so, as ECOWAS champion of the COVID-19 response, Mr. President should adopt all practical means of containing the virus within the subcontinent of West Africa. The Presidential Task Force has received with encouragement the recent United Nations General Assembly omnibus resolution seeking for a comprehensive and coordinated global response to the coronavirus pandemic, which further amplifies the significance of Mr. President's role in the West African region. The Presidential Task Force is aware that a number of subnationals have announced the reopening of schools from this week, while others have developed a phased plan for such reopening. I wish to reiterate the need for more vigilance in adhering to protocols appropriately developed with the guidance of experts. The fear of a likely spike and/or resurgence should always put us on our toes. Always remember that a number of countries, including Israel of recent, have announced new stringent measures. These are warning signs for us in Nigeria and on the African continent. Before I close this remark, I'm compelled to remind Nigerians to always wear a face mask or face covering, and to do so properly. Similarly, I remind you to avoid crowded places and mass gatherings. Stay at home if going out is unnecessary, and maintain hygienic practices of washing of hands or using sanitizers. I now call on the Honorable Minister of Health, thereafter the representative of the DG, Nigerian Center for Disease Control, and the National Coordinator to give you all the technical updates on developments, and thereafter you will take further briefings from ministers as they present them. I want to thank you for your kind attention, and have a good evening.
The Chair of the Presidential Task Force on COVID-19 Response, Honorable Ministers, the National Coordinator, Permanent Secretary, ladies and gentlemen of the press. 79 confirmed cases of COVID-19 infection were reported in the past 24 hours from 13 states of the Federation, bringing the total number of known cases as of today, 14 September, to 2020 to 56,256 out of a total number of 442,075 tests conducted so far. 44,152 persons have been treated and discharged, while 1,082 have sadly been lost to COVID-19. Though we continue to record declining positivity rates every day, we are reluctant to conclude that we are halting the spread of this disease, because many states have not sustained the testing rate that will give us the assurance. Only 13 states, for example, reported their figures in the past 24 hours, meaning that more than 20 states did not make a report. This can be better. Until all parts of the country can sustain a certain testing rate, it will seem presumptuous to conclude that we are flattening the curve. In the words of the Director General of the World Health Organization, we are not safe until everyone is safe. I therefore again request our state governments to ramp up the testing momentum by ramping up sample collection. We have requested and urged the setting up of sample collection centers at every local government area and in high-burden local government areas in every political ward so that we can improve and increase the tests. We can together get control of the spread of this disease in our country. I had the honor last Thursday of participating in the mid-year program review of the Memorandum of Understanding on Health System Strengthening, Routine Immunization, and Primary Health Care entered into by Kaduna, Bauchi, Yobe, Borno, Kano, and Sokoto states, with Aliko Dangote Foundation and Bill and Melinda Gates Foundation on the other hand. The achievements of the states in implementing the terms to strengthen routine immunization at subnational levels is impressive, as is also the benefit derived from it in the fight against COVID-19, particularly in the area of surveillance. And then the progress made through that to improve primary health care services in these 6 states. I was particularly delighted with the level of participation of traditional rulers in all these states. I wish to commend the governors of these states for their increased investment in primary health care, as well as Alhaji Dangote and Mr. Bill Gates for their sustained interest and contribution to support these states' effort at building these health structures. It is gratifying that the National Association of Resident Doctors has called off their strike, but unhelpful that the Joint Health Sector Union has begun theirs. The position of the Ministry of Health is that strikes by healthcare workers jeopardize the lives of citizens, especially at such times of global health emergencies as now. Nigeria needs the service of all her health workers to control the spread of COVID-19. Issues around allowances are multi-sectoral and have always been solved with negotiation, no matter how long it took. But I also acknowledge the commitment of the health workers who continue to man the front lines in the fight against this disease, and I use this opportunity to appeal to JOHESU to suspend their industrial action and go into negotiation so as not to erode the gains we have made since in the healthcare delivery area. The Federal Ministry of Health is doing all it can and all within its power to expedite processes that address the bones of contention. I also paid a working visit to the Nnamdi Azikiwe International Airport yesterday to review the processes of passengers arriving on international flights and to observe their health-related compliance and the challenges of staff of Port Health Services. My observations and suggestions for remediation have been made known to the PTF and to the Honorable Minister of Aviation. I thank all travelers for their patience and understanding as the process to keep our country safe are being further fine-tuned. I also advise the intending travelers to or out of Nigeria to acquaint themselves with regulations and the provisional quarantine protocol. You can find this on the websites of the Federal Ministry of Health or the NCDC. Our primary concern is to limit the risk of importation of COVID-19 virus into our country, especially with the increasing flights to Nigeria. And for this purpose, we have remained very vigilant. Our health system should not be overwhelmed by new imports, even as we struggle to contain the COVID epidemic in country. There are still no reliable new therapeutics available, and vaccines are still up to 1 year away. The much advertised non-pharmaceutical prevention measures remain the backbone of our defense, and I urge all citizens to maintain these. There is no doubt that the economy needs to be further opened, and business activities and commerce must resume. To compensate for all of this, we all need to cooperate and ensure that we are following the non-pharmaceutical interventions as our own contribution. I thank you all for your attention.
On self-isolation, and that's because we want the travelers that have come in to know what to do when they come in. They're expected to self-isolate and for 7 days, at least 7 days, and then get tested for a second time in country. So as we are all aware, we have put several measures in place to ensure that as the international flights resume, we do not see an influx in imported COVID cases. So it is important that we maintain the gains that we have achieved so far. And to achieve this, we need cooperation of all returning passengers and their adherence to the protocols that have been put in place. This is not only for them to protect themselves, but also for them to protect their loved ones that they have come to meet, and also Nigerians at large. So when we say Nigerians should take responsibility, we know this cannot happen in a vacuum. Therefore, we have continued to develop and update our guidelines in line with the best global practice and available evidence. Recently, we updated the self-isolation guidelines to reflect the current protocol for returning travelers. For every passenger that comes into the country, you must self-isolate for 7 days, for at least 7 days. This means strictly staying at home or an identified accommodation, away from situations where we will mix with our family members or the general public. On the 7th day of isolation, you must present at a designated sample collection center for your sample to be collected for tests. And the purpose of this is to ensure that you eventually test, and if you eventually test positive, you are, of course, when you're self-isolating, you would not have put your family members at risk of infection, particularly your loved ones. So for people who test positive, they will be treated based on the National Case Management Guideline. But if you are tested negative after the 7 days of self-isolation, you'll be free to join the society, that's your family members, the community, free to move about. And then you'll have that confidence that, of course, you have not infected your family members and your friends. The self-isolation guideline is actually is a guiding document and can be accessed at covid19.ncdc.gov.ng. So we urge all incoming passengers to take responsibility and contribute to the efforts that is being made to halt the spread of COVID-19. While you're in the country, it is important to continue to adhere to all measures put in place by the federal government to protect Nigerians. And this includes wearing your face mask in public places after you have exited, washing your hands frequently, maintaining physical distancing, and other public health measures recommended. So we want to urge our travelers, our incoming friends and loved ones that have come back to please adhere to all the non-pharmaceutical intervention and to also self-isolate for 7 days so that once your sample is collected on the 7th day, if you're negative, and that's good, and so we know that you're free to move about. But if such a person is positive, we will take and manage the person using the guideline, the case management guideline. Thank you.
We opened up the airports, specifically Lagos and Abuja, on Saturday last week. So we're getting to about just over a week now. And I wanted to update you on the Nigeria International Travel Portal. I know there's been a lot of publicity around this, and I wanted to clarify some issues. So, as you're aware, it's important that we realize we are yet to flatten the curve of coronavirus in Nigeria. And because of that, we have to ensure that we put in place all necessary interventions to stop the importation of new infections into our country. The PTF has continued to ensure that our responses to COVID-19 is based on sound science and data. But we are also borrowing from the experiences of other countries globally, since the world is a global village. So this is why we have established an online registration portal as part of our risk mitigation measures following the publication of our travel guidelines for international travelers coming to Nigeria, and in order to make that experience as smooth as possible for the passenger. The portal itself is a tool that ensures travelers coming to Nigeria register on the platform and complete all the necessary steps required to comply with the travel guidelines that we issued on the 5th of September this year. So what are those steps? This specifically applies to passengers outside Nigeria, not those leaving Nigeria. If you're outside Nigeria, the first step you need to do when you're coming into the country is to go and have a COVID test done. This test has to be a PCR test. We do not accept antigen antibody serological tests. It needs to be done from a certified laboratory in the country you're in, and we already have a list of accredited labs from countries that we initially had issues with their results. The test needs to be valid for no more than 96 hours. Preferably, the closer it is to the time of boarding, the better. Passengers without a valid PCR test or those with a result older than 96 hours will not be allowed to board the flight. Once you have your COVID PCR result and it's negative, you go onto the portal, which is nitp.ncdc.gov.ng, nitp.ncdc.gov.ng, and you register on the portal. When you register, you will fill the pre-boarding health declaration form. This is the same form that people use to fill manually in flight or on arrival in Nigeria. After you fill the form, you will be asked to upload your COVID-19 PCR result that's negative. If you upload a positive COVID-19 PCR result, you'll still not be allowed to board. It has to be a negative result. Once you upload your result, you will then go ahead to fill in where you are arriving to, whether it's Abuja or Lagos. We are making subsequent adjustments to the portal to enable us find out exactly where you will be on day 7 after arrival, whether you will be in Maiduguri or Port Harcourt or Calabar, so that you can choose a sample collection center within the city that you'll be residing on day 7. For the moment, we have laboratories across Abuja and Lagos only, but we've made arrangements with these laboratories to make sure that when you pay, wherever you are in the country, they will arrange for a sample to be collected from you. But we are really encouraging private laboratories outside Abuja and Lagos to work with their state governments in order to get onto the platform and provide improved access to testing for travelers. If you encounter issues with payment, this is a card payment. If you have international card, it will be easier for you to choose the dollar option rather than the naira option. And there will also be a button for PayPal for those that are unable to use the normal Nigerian banks for paying. If you encounter issues with payment, you may still pay at the airport when you arrive. However, just to make it clear, it is much faster for you when you arrive Nigeria if you have already done all these 3 steps and you have paid. It's a very smooth process. If you don't and you have to pay at the airport, then you should be ready to experience significant delays in the process of clearing. Once you arrive in Nigeria, you will have a barcode or a QR code that you will present at the airport. They will be able to download your information, confirm whether or not things have changed since the last time you completed your health declaration form, and ask you to proceed to immigration for clearance. Since starting this process, I am pleased to inform you that travelers arriving to Nigeria have been using the International Travel Portal, and we've actually collected data on how the portal has been used thus far. So far, 9,409 travelers have registered on the portal, where 5,541 persons have made a payment through the portal. Based on our technical analysis, it appears 5% faced technical difficulties with payment. About a third of travelers did not register with the portal. We do not know whether these travelers subsequently paid on arrival or were able to get to a bank to pay for it. And just to make it clear, it's mandatory that you have the PCR test done on day 7. So if you arrive in country and for whatever reason you do not have a card that works on the system and you are unable to pay at the airport, you will still have to make arrangements to pay before day 7 of your test. If you do not have a test by day 14, regardless of whether you have paid or not, we have a system for identifying persons with Nigerian passports, and restrictions will be placed on these passports for a 6-month period. For those that are non-Nigerians that have not had the PCR test done between day 7 to day 14, on their way out of the country, we will revoke their visas. So there are clearly implications for not following the travel protocol. And this is done in the best interest of the public health of our country. The PTF remains committed to transparency and good governance. None of the funds that's being paid to the laboratories is going to either the NCDC or to the PTF. A small fraction of that will be going to the state governments where these labs operate for the purpose of admin, logistics, and data management, and the rest goes to the laboratories. We are urging laboratories outside Abuja and Lagos to please key into this, because the more labs we have operating, the easier it will be to drive down cost and improve competition. It's not a procurement process, so you can have as much as 100 labs in Lagos and Abuja providing this service. The 3 key requirements are you have to be licensed by the Medical Laboratory Science Council of Nigeria. You have to have NCDC validation and optimization in order to function as a molecular lab. And then thirdly, you must be accredited by the state government that you are operating in, because your test results will feed into the state numbers. We have worked day and night with our partners, COVID, to ensure that the travel platform operates smoothly. We know that there are still some issues with the platform that we are resolving, but overall, at the moment, it appears to be working well for the vast majority. When we started using the platform in the first few days, 90% of all travelers were able to use the platform without any issues. Nevertheless, we do not want to place undue restrictions on Nigerians coming into the country that genuinely cannot use the platform, which is why we put on hold the requirement for having a QR code or barcode when you're arriving in country. But we are working towards making sure that a QR code can still be generated where you have not finished payment, provided there's evidence that you have attempted paying, so that at least we will have your health questionnaire and you will have your COVID-19 PCR negative result electronically available for us to be able to review and go back to if there's an issue. So that's with the travel portal. I wanted to just say quickly something about the upcoming elections. As you recall, last week we had the INEC chairman here. We are urging the public and state authorities to continue to follow INEC's safe election guidelines. If you're going for voting, you must wear your face mask, sanitize your hands regularly, and observe all those measures, including the physical distancing measures required to protect yourself and others around you. And please remember that no mask means no vote. Finally, we would like to, on behalf of the PTF, extend our gratitude to CAR COVID for their unwavering assistance and partnership towards making sure that our airports open quickly. We'd also like to commend the Northern Traditional Leaders Committee for cooperating with the PTF at our recent meeting with them. They are setting up a strong example for their communities and supporting the national effort in the fight against COVID-19. Thank you.
And my friends, gentlemen of the media. Well, it's a very short one from Aviation Today. This is regarding approvals for flights within the country, domestic approvals. So all airports in Nigeria are now open for flights, for domestic flights, including those that are in private charter operations, will no longer need approvals from us to go domestically, to operate within domestic airports, in all government-approved airports and in all government-owned airports. However, those airports that are private airports, which are called government-approved airports, but they are private, the operator should check the safety status with NCAA. Such airports like Jalingo, Uyo, Asaba, Gombe, Nasarawa, Damaturu, Osubi, etc. So you wouldn't need any approval from the minister, but you should kindly check in this kind of airports with the NCAA regularly, which is normal. However, all flights out of the country that are private charter will still do need approvals for those kind of flights. So also coming in, including tech stops, technical stops, would be needing approvals. So with this, it means that the approvals that are sent via either NCAA, NAMA, or myself will cease, and if there's any change, it will be so advised accordingly. Thank you very much indeed.
The question of reporting. The entire surveillance, diagnostics, and response is interrelated. It's an interrelated activity. The NCDC, as you know, is a federal organization, and they are responsible for surveillance, diagnostics, and mainly, and then they support the states in other activities. Now, the state governments are the ones who, again, push the actual activity of collecting samples, working out the surveillance, contact tracing, and so on. So there's an interdependency in there. And then not even all the laboratories belong to NCDC, we must make that clear. Even though we are activating laboratories, some are private, some are state-owned, and so on. So the job of NCDC is largely to coordinate, and the interdependency means that there must be sample collection going on. We urge them to do that. And then testing going on. Or those who, if I want to send their testing directly to NCDC, are also welcome. But the NCDC can only report what it gets. And despite the good connectivity between states, it's not always that you get results if things are not working well in certain states. I'm sure the NCDC representative will also speak about that. But the report we got now shows that results were reported from 13. Whether they tested more, whether more states tested, it's possible they did, but maybe they didn't report immediately or were late in reporting. There's a deadline within which you must have reported. And if you didn't report to that point, it won't be captured. So perhaps they did, perhaps they didn't test, perhaps they collected. Those are things that will show up later on. They will talk, because of the interdependency, you can only speak on what is supplied to you. Now, as for the psychosocial support, it is being carried out in those hospitals where you have first the facility patients and then also the specialists for it. And it goes in various forms. I can't give you exactly details about it, but I spoke with the Commissioner of Health in Lagos State, who takes it very seriously, and they do quite a bit of psychosocial support in there. Here in Abuja, we shall have to know the extent of it from the FCT authorities, because as you know, the FCT is the one managing the cases in their own domain, just as the states manage. So the extent of it, but I know that we have discussed it with Federal Capital Territory authorities. Now, the other question is about the vulnerables. We have said that more than half of all the fatalities we have seen in COVID-19 are from persons who have pre-existing diseases and those who are over 50. Whereas more than half of the cases in total are actually under 50. So we have said repeatedly here that we need to give particular attention to the vulnerables. And that's why we target our advisory on wearing masks, sanitizing, staying home at vulnerables. If you're hypertensive, you are known, you have heart disease, you have kidney disease, cancer, HIV, diabetes, even obesity, you are vulnerable. And that is why we particularly target stay at home, do not go out unless you absolutely have to. Particularly also the elderly, stay home unless you absolutely have to. And if you absolutely have to, take all the measures. Avoid crowds. Where there's a crowd, go another way. Make sure you have your mask on. Do not let your mask hang under your nose or your chin. And wash your hands frequently. Take care of yourself. So the vulnerables can even avoid getting infected. We have gone so far as to suggest, in case of mass infection in vulnerable, in particularly hotspot states, hotspot local government, creating the community support centers, one set that might take in the very at risk, but with mild or no symptoms, and perhaps another facility that could temporarily take in the vulnerable and the elderly for protection if you have a mass infection. Fortunately, we have not faced that situation, but we are prepared for that. We have discussed it, we have planned for it. That is what we have been working with the National Primary Healthcare Development Agency to have a strategy like that. We have said that we want to reduce the case fatality rate to less than 1%. And part of the strategy is giving that special attention to the vulnerable and among us. And we need their cooperation. We need their cooperation. We need their cooperation with the general public also to help to avoid the risk factors that put the vulnerable more in the line of facing the consequences of a COVID infection. Thank you.
I think Friday from Channels asked about the statistics of people who traveled in the last 1 week, the positive ones. For now, we have not gotten that data together. We're still working on that. Don't forget, it's just the 7th day that they're supposed to be tested, and once they're tested, the result comes out, and then we are able to get that data. So those that have that came in first are just getting tested, and once we get the results, we'll be able to get that across to you. And then in terms of the strategy that we're using to monitor, now when they come in, some of them are not based in the point of entry, that's Lagos and Abuja. So the state epidemiologists of the states that they're going to are notified, and their numbers are given to them to follow up. So they call, they make a call to the passenger of interest to follow them up. That's what is done. Now, at the national level, we also have an automated call system that once you key in the number, it automatically calls those numbers and asks for some various questions in terms of where you are and if you have symptoms. So that's the strategy we're using. So it's both at the national and state level that we monitor the passengers of interest. And now, Rachel, you asked about the advising schools. Yes, we're working with the Ministry of Education. We have developed guidelines, actually. Now, what we want to do is to make it simpler and easier for them to use. And so we're developing like a one-page protocol that will guide the schools, and so that it's easier for them to read and follow up. Now, one other thing we're advising the schools to do is to resuscitate their school health program. Now, this will help because in the school health program, you have other stakeholders involved, not only the Ministry of Education or the nurse in school. We have the Ministry of Health. You have so many, even within the community, working together. So if there is any event in the school, they are able to come together and respond. So those are the kind of things that we're putting in place. And then at the state level and local government level, we expect that they conduct risk assessments regularly. And that is, at the school level, they conduct risk assessments every week, looking at the children and assessing the situation. We expect that they have someone or a team that will be monitoring the children as they are, for symptoms. For those in the boarding house, they have a clinic that will, they have a team in the clinic that will be monitoring the children regularly. So those protocols we're going to put in place. We're working with the Ministry of Education to get that to the schools, to the state level, and from the state to the local government. I think for the states that have not reported active case, I think my minister has answered most of the question. It is what the states give to you that you get. We have a platform where they report, sending the electronic reporting to us. Now, some of the states have issues with their laboratories and they are not testing. But so what we say is send your sample to our national reference lab and they test for you. Some have still struggling to get people to come for testing, to come for their samples to be collected. So, but we're working with the states. Those that are not having active cases does not mean because they do not have active cases, they are not working. So there's a difference between having a confirmed case and collecting samples. We can collect samples and not have a confirmed case amongst the samples that you have collected. So we're looking at the situation. We're really monitoring the states to make sure they do what they're expected to do. And the PTF chair has really, employed all the state governors to be active, to please support their state team to make sure that samples are collected. Especially, we want that all LGAs have sample collection sites. And then we encourage our people to come out and get tested. Thank you.
Was Rachel, you wanted to know why are we not allowing testing at the airport or close to the airport? Okay, so when you are coming to Nigeria, assuming 100 of you have caught COVID on your way to the airport, but you have had a COVID test done a day earlier that's negative, all of you will board. When you arrive in Nigeria and we test you at the airport, we will pick only 7 of those 100 that have caught COVID on their way in. If we delay the testing till day 5, we'll pick an average of 85 of you. If we delay the testing till day 7, we'll pick 94 of you. If we delay the testing till day 14, which covers the whole incubation period, we'll pick 99% of you that have caught COVID on your way in. Hopefully that will not happen. That is why we said if you are coming in with a COVID-19 PCR result that is negative and was done very close to the point of departure from your point of origin, and you come into Nigeria, there is no logic for you to have a repeat test there and then, because we are only picking up 7% of you. It's better to delay the testing and ask you to go and self-isolate. Day 7, we will repeat the test, and we will pick up 94% of you. And if we pick you up, if you're positive, we will isolate you and we'll treat you. And the remaining 5% is a risk that we have to carry as a country, because we know the majority of people will be unable to self-isolate or quarantine for 14 days on their own. And that's why we're providing that incentive of reducing the isolation period to day 7, but with the proviso that we want to test and pick out those of you that may have picked the infection on your way in. Therefore, Rachel, there is no point in having a laboratory at the airport or a laboratory close to the airport if you are having a COVID-19 PCR test on boarding the flight. You can either have one of two things. You can either have a test done before boarding, or you have a test on arrival immediately. But there's no point in having both at all. It will be exploitative, it will be unnecessary, it will be additional cost to the passenger, it will be inconvenient, and it will be invasive. So that's why we are not putting infrastructure at the airport for the moment. We are looking at the current process to see how things go over the next few weeks. If we continue to have challenges, we've already started a concession process for getting infrastructure at the airport. But once we have infrastructure at the airport, it means that you will not test pre-boarding. And I'm sure you and I will prefer to sit and have lunch or dinner in flight with somebody that we know is not infectious. So the advantage of having a result from somebody pre-boarding far outweighs the issue of testing afterwards. Okay, so that's why we're not having testing. So there are certain things that we put in place as incentives to make people to cooperate with the new policy. So with the old policy, when you land, your passport will be taken away from you. With this policy, provided you have paid and showed evidence of payment, you go with your passport. With the old policy, we would expect you to stay in Abuja or Lagos, wherever you arrive, until you have had a test done and until that test is negative. With the new policy, you go to Maiduguri or Sokoto or Port Harcourt, wherever you are, and we'll arrange testing for you. So it's a lot more convenient. And then the issue of isolation, with the old policy, you isolate for 14 days. With the new policy, we've shortened it to 8 days max. and therefore you can go ahead to do your businesses after 8 days. Of course, there's nothing like a short-term visitor to Nigeria anymore. If you're a businessman, you're coming in for business in Nigeria, you have to include that 1 week isolation. You cannot just come in, go for your business visit, and then leave the country. For now, this is COVID. We are not working in normal times, and you cannot come in and just go straight into the community for whatever brought you in. You have to put that 7-day period in. Okay, so there was the issue of why are we making threats to cancel passports, and after all, people are having challenges doing the test. So my call to those that have already come in and we've allowed them to proceed home, etc., is please go back and try the portal again. We've done a lot of work to the portal over the last few days. We expect in the vast majority of cases it will work. Mostly it has to do with the use of international cards. There are telephone numbers for the labs that you may have chosen. You can contact them directly to make arrangements. You can also pay in the banks for your test. So we've streamlined it. In the past, the QR code has to be emailed to you. Those of you that had Yahoo accounts, Yahoo was identifying it as spam email and blocking it. So now we have a system where the moment you pay, the QR code, the barcode comes up straight away and you can print it. So we've done a lot of work on the portal. We are interested to know how it's working, and if you're still having any challenges, please get in touch with us. But almost certainly there shouldn't be any issues with the portal. This is the best way for us to be able to open our airports and be able to get back to business again for the country. There was a question about what proportion goes to the states in terms of the cost. So the negotiations for the total cost is being done at individual state level with the laboratories. We will have a ceiling. We don't expect any state outside Lagos, because Lagos already had their payment portal. It was already up and running. They had signed their MOU with the labs. They had about 10 labs, so we couldn't change that arrangement when the national portal was coming up. But moving forward, all the charges will have to be single-figure percentages, including the bank charge. And we will continue to work with the state governments to make sure that the cost is minimized for the passenger. We will push it as low as possible depending on how many laboratories we have on the portal. So if you have only one laboratory in a state, it will be more difficult to negotiate between the state government and the lab. But if you have several labs, it will be much easier for them to push down the cost, which is why we're saying private labs for those states. And we've already reached out to Kano, to Kaduna, to Katsina, to Anambra, to Edo, to Imo, and Nasarawa. These are places that already have labs that are accredited by NCDC, and they are part of the NCDC laboratory network. Let's get you on board. The more labs we have covering all parts of the country, the easier it will be to push down the cost. We know PCR is expensive. There's no doubt about that. But at the same time, we don't want passengers to be unduly burdened. And that's why when it comes to exclusions, exceptions, we are making exceptions already. So if you're in a vulnerable group like the young girls that are coming in from Lebanon, they will not pay. If you have had your ticket paid by a UN entity or IOM, etc., for the purpose of a deportation or another country, we know that you're probably not going to be able to pay, and we will get the public health system to pay for your test day 7, well, to have your test done day 7. And also, young children will be excluded, and those with diplomatic passport holders will be excluded because they have other arrangements for testing outside the private lab network. So, sustainability arrangement for COVID-19 as a response. Well, all I can say is this is a pandemic, okay, Rachel? In a pandemic, you have costs attached to it. But what will be good is for the country to learn from the experience of COVID. In other words, try to normalize and integrate the things that we know should be part and parcel of our daily routine when it comes to delivering healthcare. So for instance, all medical wards or surgical wards should have hand washing facilities. When you walk in, you have running water that you can wash your hand. When you see a patient, in between patients, you wash your hands. Simple infection control. 2, training of healthcare workers should not be based on just having an epidemic of Ebola or Lassa, etc. All healthcare workers should know how to use PPE. They should know how to pick up danger signs in patients presenting, and they should be able to handle infectious cases. And then thirdly, provision of PPE should be part and parcel of routine procurement processes for health institutions. So in the same way that you're buying paracetamol or syringes for your hospital, you need to make sure you have masks, you have gloves, you have coveralls, etc. in the event that you need them. I think I've answered all the questions. Thank you. Sorry, Rachel? Oh, okay. So the budget, in fact, we had, so as you know, the PTF budget is divided into 2. We have money that is coming from the MDAs. It goes as part of the normal 2020 budget. And then we have money that's coming from a special intervention fund that was given to PTF. 22 billion naira was given to the PTF as the first tranche. Of that 22 billion, we paid 1.2 billion to the security agencies, 250 million to Federal Ministry of Foreign Affairs, Ministry of Foreign Affairs for the evacuees. We had operational costs to some of the MDAs, but in total, we've spent barely 3 million. We still have about 19 million, of which 8.4 billion was given out as procurement by NCDC. That was approved by FEC. So, Rachel, we still have more than 70% or so, or 80% of the money we were given, first tranche. And we are already almost month 6 into the response. So hopefully we would not have to go back to government for a huge tranche of money going into the next 6 months. And as you're aware, we've had tremendous support from the private sector, from the UN single basket, etc. We have the portal. Please go onto the portal. We have the transparency portal where all the donations are there. All our money is there. And we will also be providing information on what we have been spending from week to week or month to month. But we still have a lot of funds that we hope to reprogram over the next 3 months to make sure that they are spent diligently. So I wouldn't worry too much if it is money. Okay, thank you.
So, folks, this decision by the task force COVID-19 is a decision of the task force. And we take our job very seriously. Under the chairmanship of the SGF and the national coordinator, we've been here since March, doing things that are very diligent. We're taking healthcare as a very serious matter. There's nothing political about it, and no decision will be taken diplomatically or for a tit-for-tat diplomatic relationship. Far from that. Every decision is based on certain concrete constants and variables. So regarding who comes in and who is not approved, you all know that we have the challenge of the number of passengers that we can process in our airports, given the resources, human or material, that we have to fight this COVID-19. If there were no challenges or restrictions, we would have opened the airport and everybody would come in. But we have a certain number, that predetermined certain number that we can process in these our airports, and that's why we're opening only Lagos and Abuja. And based on that, we have to calculate, based on facts, based on available number of passengers, based on protocols and facilitation, to decide how many number of passengers can we handle per given time, from where and how. So the airlines were contacted. For those who are able to take passengers out of Nigeria that are non-resident with tourist visas, were tabulated and calculated and contacted, and those who are not able to do so. So it has nothing to do with country per se. The decision was taken, and that's why you have in UAE, for example, Emirates are allowed to come in. And the first few flights they would do, I think the first 7 flights, they're using it to return Nigerians back to the country. And Etihad was denied, and the same UAE. It's not approved. So Lufthansa, Air France, Air Namibia, and Rwanda Air, etc., were not approved based on these principles. So we maintain the number that we can handle in the airport, and we keep it to those who are able to take non-resident visas, those on tourists, etc., in and out of the country. So this is some of the reasons why we took that decision to get the airlines approved or not approved, and it's a collective decision by the PTF. Whether there is discussions going on, yes. The all Nigeria management staff of Lufthansa were in my office. For the first time, they have all Nigeria management. They were in my office. We discussed for about an hour and a half or 2 hours. And I'm sure they were very glad that they came, because this was explained to them, for which I believe they understood. Air France KLM was also in my office for an hour and a half or 2, and we also discussed, this is in the last couple of days, and they also understood our position. And currently, the PTF, we have had requests through the normal channel, and the PTF had mandated the Honorable Minister for Foreign Affairs to coordinate a meeting with these concerned airlines and perhaps either their home country or their representatives. And so, yes, talks are going on. And then also whether some of these airports will be opened, i.e. Enugu, Kano, and Port Harcourt. They will only be open once we're able to process this number of passengers into the country. So everything is being well calculated to ensure that we're able to all remain safe. So like I said, every single decision that is taken about healthcare, immigration, aviation, disaster management, foreign affairs, information, whatever, is a PTF decision. It's not by any single minister. And that's why in the first place, that's why there is a task force. Otherwise, we'll just continue doing our own jobs in our various offices. So I'd like to drum this point home, that this decision is thorough, is always thoroughly discussed at the task force, and decisions are taken. And please bear with this unusual situation. And by the grace of God, it will soon be history. And thank you for your cooperation and understanding. And you have a good evening. Thank you.
That everything about this school opening has been cleared. But let me just make that a little bit clear. Last week, the PTF announced that as part of the revised reopening model of the country, that schools were now in the mode to reopen. So essentially, starting from that day, schools are able to reopen. But as you may have heard from the representative of the NCDC, those are going to be done with guidelines. The guidelines we're issuing as a country would also extend to the subnationals. This is a national response, and the idea is that once this national response gets to each of our subnationals, they can then interpret them along the lines that are local. All primary schools up to the post-secondary school, post-primary school level, all have the participation of subnationals. So at local government levels, they have different nuances, and they need to check that they meet those requirements before they open. But at the tertiary level, that guidance will also be done in association, in collaboration with the Nigerian Universities Commission, so that you're given the clearances that then say that we are satisfied with your performance as it relates to that guidance. What she has just explained is that we are reducing this whole gamut of document into some measurable, quick walk guide in a page, 10 steps to reopening, such that the governing council of each of the institutions will then review that and benchmark it, because the responsibility that we are issuing would be to the governing council. So there will be some recommendations, already there are recommendations on that guidance, so that if you go to our website, you'll see all of this. But we're reducing it to an immediate quick check, so that you have a template with which you can do a quick check guide that says you're ready or you're not. You may have heard several states begin to make moves around reopening. They are all in order. This is exactly what we expected from what the PTF chairman issued last week, that guidance will now happen. And everybody should then begin the processes of reopening. However, they must be guided. They must make the provisions that we've required. That in every state, we have quality assurance personnel that are reporting to the Federal Ministry of Education, and we will not hesitate to shut down any place that is not in compliance. We really would want our children come back to school. These decisions were made in pursuance of the science and the data that has now come forth. As it is, our case fatality ratios are low. As it is, positivity in 1,000, you see what the numbers are. So we are a little bit confident that we're walking in the right direction, but we need to be guided. So really, while I thank all parents who have helped me keep all my children safe for these 6 months, I will really want all of us who are in co-governance to please be guided as we take those steps. Thank you very much. So what? Yes, I'm sure you have seen me junketing from every federal school I can find to the other, just checking their state of preparedness, just the same way I've asked them to. I'm not just talking. I'm actually going around making sure that all of our schools are also in the same state of preparedness. Under the same guidance, yeah.
Me today. Nobody asked me a question. Yeah, you want me to raise, thank you for that. But I think the most important thing is that as we approach this particular phase in which we are, particularly when we see the numbers declining, the tendency is to lower our guards. We can see from examples of different nations what happens when that is the attitude of the people in the country. We are not expecting a second surge in our numbers. We're trusting God that we will be able to calm the numbers in the manner in which they are as we ramp up our tests to see what is happening in the community, so that we can structure our response to deal with the issues in the communities. Yesterday, we had our lowest number of 79. And that can create some sense of victory. But truly, we are not out of the woods yet. That's my candid advice. We are not out of the woods. We must take this thing seriously. Even nations that are regimental in the manner in which they control the COVID in the first instance are having serious cases. A typical example, Israel, with about 9 million people, have more infections than we have. And in the last couple of days, they've been recording a minimum of 1,000 plus infections, which has necessitated a total lockdown of the nation for 3 weeks. And for those of you that are familiar with the history of Israel, this period is one of their most holiest and sensitive periods. As we have the Ramadan season in Nigeria or the Christmas and Easter season, this is their holiest season with the celebration of Yom Kippur. But as a government, they have introduced a 3-week lockdown nationally, not selective, because of what they are seeing the figures do. Even countries like New Zealand and Australia, which for all intents and purposes had gotten over COVID-19 for a period of months, not a single infection, are beginning to have some resurgence in figures because they have begun to slow down on the implementation of the non-pharmaceutical measures and also obstructing infections, and they are beginning to see a resurgence of the infections. And if that is happening in countries that are slightly regimental like Israel, then I think we better slow down and pause a little bit and begin to take advantage of the calmness that has come as a result of the spread in the communities and drive home the ownership of the non-pharmaceutical interventions. And that is what has accounted for our change in terms of ownership, in terms of the narrative out there. The meeting with the northern traditional rulers has paid off, because very soon you will begin to see some elements of ownership at those levels. Even the advancement of the messaging of the non-pharmaceutical interventions in terms of risk communication is being seeded. I think we all fatigue. Nigerians have had so much from us. It will be very, very important and imperative that they begin to hear from key leaders in their communities. And that is what we will begin to do now, so that we can take advantage of the fact that the spread has slowed down. We don't believe that the testing is reflective of what is happening in the communities. But if we succeed in seeding the narrative, the drive of the messaging, the risk communication to the leaderships at the different communities, it will help tremendously in the little time we have in the lifespan of the PTF to be able to say substantially we have dealt with the spread of COVID-19. So what is my message to all of us tonight is that let's continue to comply with the non-pharmaceutical interventions, the wearing of masks, of any cloth covering, when you step out of your home, keeping personal hygiene in terms of washing of hands or use of sanitizers, maintain social distancing, and also avoid large crowds. And please, if you have no business leaving your house, just remain at home. That way, you protect yourself and you protect your loved ones. Thank you, and have a good evening.
Chairman PTF, that effectively brings us to the end of today's national briefing. A number of messages have come out. If you're watching us from home or wherever, and you have missed part of this briefing, let's just give you quick takeaways. On September 11, the world marked 6 months exactly since COVID was characterized as a global, as a pandemic. 2 is that our declining numbers should not be taken as a sign that we have overcome this pandemic. States, we urge you to please ramp up the testing, collect the samples, and let us detect and go further on actions against the pandemic. No one is safe until everyone is safe. Let us sharpen our focus on the task of flattening the curve and overcoming the virus. For our colleagues in Johesu, we appeal to you to call off your strike in national interest and the interest of humanity. For travelers, intending travelers to Nigeria, we want to inform you, we want to advise you to please acquaint yourself with the regulations and the protocols. A PCR test negative is one of the preconditions for boarding. We also urge you to obey the rules of self-isolation diligently when you arrive Nigeria. If you flout the rules, there are consequences. If you do not present yourself for in-country tests after arrival, there are consequences, part of which is that sanctions will be placed on your travel documents if you are carrying a Nigerian travel document. What COVID-19 has taught us is that fundamentally, we are all connected. Disease anywhere is a threat everywhere. Never has the world's interdependence and the value of common good been more pronounced than now. What do? You mask up, you obey the MPIs, you keep social distance, ensure strict self-isolation if you have to. And we have also been told that our airports are open for domestic operations. That is for government airports. For government-approved airports, you have to check your status with the NCAA. We thank you very much. God bless Nigeria. We hope to see you on Thursday.